Hello, everybody. This is Dr. Salvador Medina. I'm talking to you from Tijuana, Baja California. I'm very glad you can join us. We're very excited for this meeting. The idea of this chat is for you to let us know if you have any questions about any plastic surgery procedures. I know there's a lot of information going on with the pandemia. So there are a lot of questions of how we're going to start working again, what are we going to do, what safety measures we're going to take. So let us know if you have any questions. Also, and in the comments, let us know where you're joining us from. If you're already my patients, if you're just seeking for some information, let us know if you have any questions, so we can answer any doubts that you have. We're excited because soon we're fortunately going to be able to return to work. I'm going to be able to see every one of you. And let us know. We have a lot of time, so we can solve any questions that you have. Okay, so let's start.
Great. So my name is Mayra Rocha. For any of you who don't know me, I am Dr. Salvador Medina's social media moderator. So I'll be reading your comments and I'll be letting him know so that he can answer all of your questions. And the first thing, doctor, that patients have been asking is about the new process for the opening of the hospital. What is that? What does that look like? When does the hospital open?
Yeah, so the hospital has been pretty much locked down because of the pandemia and the COVID-19 patients. There were no non-essential consultation or surgeries, anything like that. It's been almost over a month. So now the end of May, first days of June, the hospital is going to reopen for scheduled surgery. Of course, everywhere and everybody is going to have to take different measures to prevent the spread of this infection, because it's always a concern for everybody to go to a hospital where you know that there have been patients that were infected with COVID-19. So it's very important for the hospital and for us as doctors that work there, everybody's safety. So the hospital is going to take a lot of measures like disinfecting and cleansing every single area during scheduled hours during the day. Drastic measures in the operating room. So the hospital is taking this very seriously. The hospital where I work is the Hospital Ángeles de Tijuana, probably the biggest hospital in town. They're very, very professional. It's a hospital chain. There are a lot of these hospitals all through Mexico. Probably one of the most serious hospital corporations. So it's very important for them to take very seriously patient safety. And particularly for me also, this is very important because the patients that I see are patients that don't need urgent surgeries. They're always scheduled. So we wouldn't want to put anybody at risk. I know this virus it's very difficult to control 100%, but we will do whatever we can to keep everybody safe, to keep the patients safe, to keep the hospital staff safe, my surgical staff safe. So we're all involved. We're on in this together. the hospital will reopen now starting June. We're still figuring out the exact protocols that we're going to have to follow for the scheduling of surgeries. We're going to go into that with a little bit more detail further on once we're sure what we're going to do. We're also, as probably a lot of you know, I'm a member, an international member of the ASPS, the American Society of Plastic Surgery. We're also following their guidelines for patient safety. For now, these associations also, the Mexican Association of Plastic Surgeons, they're emitting recommendations. So we're going to follow these recommendations, the Mexican and the American recommendations that we get. I usually combine that information to have the best outcome that we can. So yes, we will be guiding ourselves through these recommendations. During the office consultations, a lot of things are going to change. We're going to have to space out our appointments. So there are probably one person at a time at the office. Of course, every patient that come with me, they have to come. Somebody has to come with you. So you can come with one person, but just one. We'll let you know if they can come in to the consultation or not. We're going to use facial masks, hand sanitizers, and all that. So we're going to take all that into account so we can assure that we're doing the best we can to keep everybody safe. So we're glad to know that starting June, the consultations are going to reopen. So the office building is going to reopen again, and the surgery scheduling, we're going to be able to start scheduling again. So that means that if anybody is interested, we're good to go starting June.
Perfect. And one of the questions that we have been asked this week is a lot of your patients wanted to know what they're interested on the Mommy Makeover, but for a lot of them that are not clear, what does this entitle? What is the recuperation time on the Mommy Makeover, and who is a candidate for it?
The Mommy Makeover is a term that was acquired for the moms. Once they had their children, they're not going to have any children anymore. All the body changes that they had, because of course pregnancy is going to stretch the abdominal muscles, it's going to stretch the abdominal skin. They gain weight, then they lose weight, then they breastfeed, so the skin in the breast stretches, then it comes down again, then the breast, sometimes it sags a little bit or a lot. So that term was acquired for the patients that are over having children. They have a definitive birth control. So there's no possibility for them to get pregnant again. That's the ideal. So we address the abdomen abnormalities, the some fat deposits that you may still have in the back, the flanks, or the love hands that we call them, sometimes the arms, of course the breast. So usually what we do is for the breast, depends, we have to evaluate every person independently. We can do only a breast augmentation. Usually we need a breast lift that we can do with or without implants. We do liposuction to bring out that contour that we're looking for in the back, in the flanks, sometimes in the abdomen. And the abdomen, we usually do an abdominoplasty that can be traditional, what we consider traditional, which is the scar that goes from the hip bone to hip bone sometimes we need to do an extended abdominoplasty or tummy tuck. That the scar goes a little bit beyond that point. We do the abdominal muscle reconstruction because the abdominal muscles tend to spread apart. So we bring them back together so we can have a flatter abdomen, and we take out the excess skin. We their children, they're not going to have any children. The belly button. We always use your same belly button. We don't change it. We don't move it. We just place a scar around it. That allows us to take out all the excess skin and pull it down so you can have a nicer shape in the abdomen. So usually that's what we do. Breast surgery, implants or not, lift or not, liposuction. We usually, once we're there, we use the fat that we take out from the back and put it into the butt. So we do the Brazilian butt lift at the same time. That brings out the contour and we have a nicer shape for the butt. And then the abdominal area. We can also add liposuction in the arms or thighs, depending on what everybody needs. And for the recovery time, usually the most important part is the first 2 weeks, because that's when we have to take a lot of care for the scarring process. That's when we can have certain complications with the wound, with the scarring process if we don't take care of ourselves. First 2 weeks, you can move, walk. You have to be walking. You don't need to lay down or sit down all day. On the contrary, it's better to be active and walking, but just walking. So you can't do any efforts. You can't lift anything. You shouldn't be bending over, lifting things, driving, no physical efforts. Of course, you can't exercise. So first 2 weeks are very important to be active, but no physical efforts. After 2 weeks, you can start stretching a little bit more. You can start bending, maybe lifting a few things, start driving after 2 weeks. After 4 weeks, you should be able to start doing full range of movements, everything, and exercise between 6 and 8 weeks, depending on how you're doing. But that's basically how you're going to recover from that surgery.
Doctor, and we have one question asking you, what is the difference? This is a question on implants, breast implants, and one of your patients is asking, what's the difference placing them under the muscle and over the muscle?
Okay, that's a good question. Usually for me, well, first of all, I only use silicone gel implants. I don't use saline implants. I think the saline implants have a lot of disadvantages. There are not many surgeons that still use them. And when to place it underneath the muscle or above the muscle. There are a lot of criteria out there in certain plastic surgeons, so this varies a lot. But for me, I do recommend putting the implant underneath the muscle when it's a patient that has almost no breast volume, very little breast volume, or very little breast volume and the upper pole. If you don't have a lot of breast tissue on the upper pole, sometimes it's better to go underneath the muscle. Why? Because if we put it above the muscle, then sometimes you can see that very round shape of the implant. And that's not very natural. For me, it's very important to get a natural result. That's, in my concept, the best thing, to get a natural result. So seeing a very rounded shape in the upper part of the breast is not very natural. So if we go underneath the muscle, there's a smoother transition between the chest and the breast where the implant starts. So it gives us a more natural look. If you do have enough breast tissue, I don't think that it's necessary to go underneath the muscle, because aesthetically, it's not going to change. It's going to be almost the same. And going underneath the muscle, technically it's a little bit more difficult, and definitely the recovery is a little bit more difficult, a little bit more painful. Sometimes the muscle can pull and displace the implant up. So I usually, most of my patients, I do put it above the muscle. But of course, this depends. There are patients that do need to go underneath the muscle. Also, very important for me, most massive weight loss patients, it's better to go above the muscle. Because what happens in time in those patients is that if we go underneath the muscle tends to keep the implant in place. But there's a difference between the implant position and the breast tissue. So at first, the breast tissue should be where it's supposed to be. And then in time, the breast tissue is going to fall over the implant. So you're going to see the implant up and the breast tissue in the lower part. And that's not a very nice thing to see. And that could happen quite soon, probably within the first year. So I think that by going above the muscle, the implant and the breast tissue is in a little bit more synchrony. They're more together. They always fall a little bit into a natural look. They're not going to sag as they were, but they do settle into a natural fall. That's because that's the natural thing in the breast. It's always going to be a little bit, I'm not going to say sag, because the idea is to get rid of the saggy part of the breast, but they do settle in, and it's natural to have a crease underneath the breast. So it's going to fall a little bit, but into a more natural position. So I take into account the amount of breast tissue that you have, and if by going underneath the muscle we'll have a more natural look, then we'll do that. But not every patient needs to go underneath the muscle. So that's basically the idea with the position of the implant.
Great. And a second question that we have is on a thigh lift. Who's recommended to get thigh lift, and what is the process? And I think one of the big questions is always, how long is the recuperation again?
So most part of my patients that undergo a thigh loss patients, usually those are the patients that do need an inner thigh lift. So in the massive weight loss patient, the thigh is going to sag in the outer part and in the inner part of the thigh. So the outer part, we take care of it when we do this circular abdominoplasty. That's one of the reasons that we need to go 360 abdominoplasty, because by doing that, I'm able to bring up the lateral part of the thighs. Then we're going to have to do something with the inner part of the thighs. So there are basically two options. One is the scar that goes in the crease and goes back into the lower part of the butt. So we can pull the excess skin, which is usually in patients that don't have that much excess skin. If there's a lot of excess skin that goes into the mid part of the thigh or even into the lower third part of the thigh near the knee, we need to do a scar that starts in the inguinal area and goes down in the inner part of the thigh down to the knee. So that's the way we can take out all the excess skin. That's the only option that we have. But that way we take out the excess skin and redrape all that skin so it's nice and smooth again. I always combine it with liposuction, because by doing liposuction, we can also bring out a nicer contour in the legs. And it also allows me to take out a little bit more skin and preserve a little bit better some blood vessels and lymphatic drainage. So we always combine it with liposuction. So basically, it's in the massive weight loss patients, but there are a few patients that are not necessarily massive weight loss patients, that they have this a little bit excess skin that no matter how hard they work and they work out, and it just doesn't go away. So sometimes we can do just liposuction if they have very, very good skin quality. We do liposuction in the inner part, and then the skin is going to redrape nicely, and they're going to have a good result. But patients that probably don't have that very, very good skin quality, we can do liposuction, but we also need to readjust a little bit that skin. And in those cases, we'll do only the scar that goes in the crease and goes to the back. We don't need to do the scar that goes all the way down, because usually the excess skin is not that great. It's only in the upper third of the thigh. And by that, we do liposuction, bring out a nicer contour, and also readjust the skin. So usually massive weight loss patients, most of them do need it. And sometimes some patients that are not massive weight loss, but they will benefit very nicely by having that scar and taking out and getting rid of that excess skin. That sometimes it's very, very difficult to get rid of just by exercising. So that's basically the idea for the inner thigh lift.
Great.
Oh, and the recovery time. It's basically the same as most part of the surgery. First 2 weeks are the most important one. This is a surgery that if you do certain movement where you're going to pull and stretch the skin in the thigh, we can have certain complications. We can have a wound dehiscency. That means that the wound can open, and then we're going to, I mean, it always gets solved, but we're going to have to do apply certain dressings and this and that. So it's very important. First 2 weeks, I'll let you know which movements you should never do. Because if you stretch that area, it's an area that the skin, when after the surgery, the skin is really, really tense. So if you stretch it, you can't open it. So that's very important. First 2 weeks. After 2 weeks, scar is basically healed, and then again, you can start stretching a little bit more, moving a little bit better. After a month, scar should be basically healed. You should start to do any type of movements and exercise after 6 to 8 weeks.
Doctor, and when it comes to post-bariatric surgery, when should a patient get this surgery? In this case, there's patients that have lost half the amount of weight they want to lose, but they sort of got plateaued right there. Is that a good time to get this surgery, or should the patient wait till he is at his final weight?
It's very, very important. I mean, the ideal thing is for the patient to be at the weight, the best weight they can, the closest they can get to their ideal weight, which is sometimes very difficult to be there, but as close as you can get, that you feel comfortable and that you know that you can maintain that weight. We're always going to see the body mass index. Through the body mass index, and I know when they still haven't dropped the amount of weight they need, then I don't recommend going into these surgeries. Usually it takes about a year after the bariatric surgery. There are some patients that drop the weight a little bit faster. There are some that take a little bit longer. So usually it's about a year. Once you've hit the goal that you have, it's important to be able to maintain that weight. So more or less a year, when you're around your ideal weight, doesn't have to be your ideal weight, but that you feel comfortable. Ideally, your body mass index should be between 25, no more than 30. If it's more than 32, you should not have that surgery. That's like a general concept. You have to see case by case. But once you're there and you're able to maintain that weight for at least 3 months, then that's when you should undergo this surgery, because you're in a good weight. You're not going to be dropping more weight or gaining weight, because if we start with the body contouring surgeries and then you start to regain weight, then the result's going to change. Same thing, if you start losing a lot of weight after surgery, the result is going to change. And then to make corrective surgeries after weight fluctuations, it's much more difficult. So I do recommend, don't rush into it. There's no need to rush into it. Let's wait more or less a year where you're comfortable at your weight, you're able to maintain it. That's when we should start planning these surgeries.
Great. And for those that are wondering about, have more questions and want to speak to you in detail, can you explain how the eConsult works?
Usually we start with the evaluations through email. My surgical coordinator will contact you, ask you for certain medical information and some pictures and what you want, what you expect. I see the pictures. For me, with the pictures, I have a very good idea of what we can do, what you should have, and see what you want. So we can do a surgical plan with that. Usually that's enough. I know that what you need, we give you, we let you know what I think, what we should do. If you agree and you think that's a good plan, we go ahead. We schedule dates. We take care of transportation. So we ask all our patients to fly to San Diego Airport. From there, we pick them up and we bring them over to Tijuana. And depending on what the schedule is, take you directly to the hospital, or they might take you to the hotel and then you go to the hospital. That depends. But if through the email consultation you still have some questions, we can always solve them. With many of my patients, I talk over the phone, so we can have a phone conversation. If you want a video chat, we can also do that. And especially now that we're starting to do this much more often, we can do that. There are a few platforms that I use. So of course, we can always schedule a consultation. The idea is for you to come over to Tijuana with as less questions as possible, as less fears as possible, because I understand perfectly well that it's not easy to make that decision, come down to Tijuana, because probably you've never been here, and then you hear a lot of things about the city, which most of them are not true, but I understand that that generates some uncertainty and some fear and what's going to happen. So the idea is for you to come down as calm as possible, knowing that we're going to take good care of you. But if you still have things that you would like to discuss with me, very easy, through my surgical coordinator, Aura. Let her know that you would like to have a conversation with me. And of course, absolutely no problem. We can schedule that conversation over the phone or a video conference. That's always a possibility.
Great. And then just to summarize what you said at the beginning, for those that joined a little late, you are open for consults in June and July, and you're also, can you explain a little bit on the 20% discount that you're offering?
Sure. All the patients that want to schedule their surgery now in June or July, I mean, we understand that this has been a difficult time for everybody, but I don't want you to lose that hope and the idea of changing something to have a better life quality, to feel better about yourself. We don't want you to lose that. So what we can do to help is by the economic part is offer a 20% discount if you schedule June or July. We'll help you out with that. So there, you don't feel that there's going to be too much pressure because of the money and all that. So we also have a financing company, which is based in the US, that can help you out with financing. So also through Aura, my surgical coordinator. Well, this is what happens when you're at home. No, pero allá afuera con mamá. Porque sí. Okay, so about the financing, you can always ask Aura, my surgical coordinator, to about the financing plans that we have. So that's another option you can explore. And of course, this 20% discount in June and July.
Great. Well, thank you, doctor, so much. You answered all the questions that were asked, and we hope to see you again next week for another quick Facebook Live that your patients seem to be enjoying.
Okay, thank you very much. It was nice talking to all of you. Please don't hesitate and contact me. Let me know if you have any questions. We'll always here to resolve all your questions, okay? Yeah. Okay, thank you, everybody, and goodbye.